Hi there, my name is Dan Crespi. I'm a paediatric gastroenterologist. That's a specialist for tummy troubles in children, and I'm more than happy to see children of all ages from newborn up to the age of 18. I'm guessing that the fact that you've opened up a video with this topic means that there may be something that's concerning you about your child's tummy. So I just thought I'd briefly run through the website that I've set up for the Kids Gastro Care Clinics. Some of it's fairly simple and straightforward to understand. It's some about the gastro clinics, a little bit more about my background, so you know a bit more about me before you choose to come and see me, if that's what you decide to do. There's a tab here about reasons why you may want to come and see somebody who does what I do, reasons that include all the symptoms and conditions that I can deal with and help organize tests for to help make a diagnosis. If you want to know more about the clinics, then of course there's a tab here that tells you much more about them. There's clinics that are running at the moment for face-to-face appointments in Elstree in Hertfordshire, as well as in Golders Green. Currently the Royal Free Clinic in Hampstead is not running a face-to-face service for paediatrics, but the other alternative to face-to-face clinics that we've all found very helpful in the last 6 to 8 months are the video consultations. And I'd be more than happy to have one of those with you and your child after a brief discussion first, just to make sure that's the right way of doing things. And also, of course, as a follow-up after an initial consultation, if I've met you already and examined your child, and this would be a perfectly satisfactory way of running a follow-up appointment as well. If you want to know a bit more about people's experience of the clinics, then please feel free to have a look at the reviews tab. And the other page I point you towards is the useful resources page, where I've put a lot of information there about some of the more common areas that, as a pediatric gastroenterologist, I see in my clinics, including celiac disease, tummy ache, constipation as well. I've covered a few more topics within the blog there, and a bit more about pediatric endoscopy. And if you click on the actual useful resources page, what you'll find is a whole host of information there that is fairly useful. And on the page, from the top down, you'll find a whole lot of different topics that you may find helpful, including about the digestive system and the wonders of it, the fantastic DK website, which goes through a lot, and we may sometimes touch upon during the clinic consultation, and it's worth looking at with your child. It's amazing. I still get amazed by the gut and some of its features, and this website is just unbelievable. Never had anything like this when I was a child, and it's just amazing to look at, actually, and to run through. But going back to the useful resources tab, there's a video here about endoscopy, should we ever come to need that. And it's a very child-friendly video that lessens any worries or fears about it, but a really useful link on here that I've set up for you as well is I sometimes ask for a bit of homework to be done. I'm not a very strict teacher by any means, but it's really useful to sometimes complete a children's bowel diary. And when you click on that link there, we come to a page that looks something like this. You may not have realized this, but poos have been researched so thoroughly by different researchers over the years that they've classified the consistency of poo into different numbers, types 1 through to 7. 1 is a rabbit dropping or Malteser like stool, and 7 looks a bit like gravy. 4 is a slippery sausage. And what's useful is to keep a record of what kind of consistency poo types 1 to 7 comes out, and record that in this column here alongside the day or date. And on this side here, record any symptoms such as tummy ache or straining, vomiting, anything else that's going on, medications, and also the food that your child's been eating at the time as well. So we can analyze that together, either in an initial or a follow-up appointment. You can always scan through this to me and I can look at it with you in a video consultation as well. And that's often a source of useful information that we find. So if you do feel I can be of any help to you at all, then please feel free to be in touch. Give me a call on 07956 550 446, or book an online consultation, or send us an email from our contact page and just fill in this simple form here. So I look forward to hearing from you, and take care. Bye-bye.